Welcome to The Pulse, presenting interesting conversations with leaders in healthcare. Today's guest is Teonna Woolford. And now, here is your host, Maria Zamptulis.
My name is Maria Zampatulis. I am a Senior Research Associate at the Power of the Patient Project, the National Library of Patient Rights and Advocacy, an entirely volunteer-led and run organization that celebrates and seeks to empower the patient through education and advocacy. Welcome to our video interview series. Today, as our first guest, I am privileged and honored to welcome Miss Teonna Woolford, a sickle cell warrior, advocate, and founder of the nonprofit, the Sickle Cell Reproductive Health Education Directive, co-founded with Dr. Lydia Pecker and Dr. Kim Swith-Whitley, world-renowned hematologists. Teonna, I am so honored to have you as our guest. Just to give our audience a little bit of background, you have a tremendous journey, and you have done incredible work in the area of advocacy. You have encountered numerous struggles and health complications with sickle cell. Just to name a few for our audience, a double hip replacement, pain crises, and a bone marrow transplant. To name a few, just to name a few, you have discussed advocacy work with world leaders, former First Lady Michelle Obama, the late Congressman John Lewis, and you have contributed to numerous publications and working committees for the National Society of Hematology. And it is my honor once again to have you join us to cast a spotlight really on this very important medical condition. And I'd like to just start by asking you to share a little bit about your journey for those who might not be familiar.
Yeah, absolutely. Well, thank you so much for that lovely introduction, and thank you for having me as a part of this video series. So it has definitely been a long journey, and I'll try to give you a condensed version. That I was born in 1991. So by that time, newborn screening was, something that newborn screening was the way that I found out about or that my family found out about the diagnosis. So we knew pretty early on. And it did come as a surprise because though my mother knew that she had trait, my father was adamant that he did not have it, even though he actually had not been tested. So the diagnosis did come as a surprise. I think that I always really thought that sickle cell was a disease of pain. So if I wasn't in pain, I was healthy. It took a while to set in for me to understand that even when I'm not in pain, I'm sickling. And so there's injury being done on the inside. So I started I had my first health complication at the age of 2.
Wow.
In my spleen, where all of the blood was trapped in my spleen. So splenic sequestration. I had that at age 2 and age 4. I did not have a lot of what they call vaso-occlusive crises growing up. What I did have was acute chest syndrome, which is like vaso-occlusion, but in the lungs. So it can be fatal. And I would get that at least once, sometimes twice a year growing up.
Wow.
And then things really spiraled out of control for me when I hit puberty, which living with sickle cell disease, it's not uncommon to start that late delayed puberty is something that we see in this population. So I started puberty around age 14, and that's when things really started just spiraling out of control. I did start having frequent pain episodes, just unpredictable sharp pain that would be triggered by like weather changes, stress, or sometimes just, there would be no trigger. So that was incredibly like isolating because, that's the age where you're wanting to fit in and just, blend in. And I was missing a lot of time from school. I went to a predominantly white school, so they were really unapologetic about the fact that they had no idea what sickle cell was. And so even the administration at the school, and this was a private, exclusive school that my single mother was making all kinds of sacrifices to send me to. And administration would make comments like, oh, it'd just be so much easier if you had cancer
Oh
because
my
at least
gosh.
then we know when you were going to miss time. But with sickle cell, it's so unpredictable.
Oh wow. I'm so
Like having,
sorry.
yeah, and like having to shoulder the burden of making up work, keeping up with what was still going on, and then also having to like educate and advocate for yourself. And I think that having to do that at an early age has a lot to do with the advocate that I am today. Um, and I came from a really amazing family where they really instilled in me that I could do anything that I wanted. It just may have to be done differently and it may take longer. Um,
Yes.
so like, and an example of that is like, cold weather is a trigger for me. So
Mhm.
when everybody else is out of school on snow days, like making snow angels and all like that, I couldn't do that. But my grandmother, she would fill up like pots and pans with snow,
Oh,
bring it into the kitchen for me, and I'd still get to play in the snow. Um,
I love that.
yeah, so high school was really, really difficult. I missed like 80% of my junior year of high school. That is the year that I had my hips replaced. I had both hips a week apart from each other. And
Wow.
I was getting a lot of infections and also a lot of the pain crisis. So missed a lot of time. And, that's when you're starting to look at colleges and it's a really critical time. I missed like 60% of my senior year of school. So at age 19, when all of my other friends had settled into college, I just was at a state where my body was just constantly failing me. And I wasn't really living the quality of life, that I thought I should live. And so that is when I started having conversations about a bone marrow transplant. So actually at age 18, I gotten on the national registry. But like many people of color, I did not have a donor. So kind of gave up that idea of being cured. At the time, bone marrow transplant was the only known cure for sickle cell. And then at age 19, it actually was one of my mother's students. My mother is a nurse, and she had
Okay.
just transitioned from bedside nursing into teaching. So it's actually one of her students who
Wow.
approached her and said, like, "Hey, professor, like, did you know that there's this newer research around where your daughter could be a candidate for a haplo-identical bone marrow transplant, and you could actually be her donor?" So
Wow.
we took that information back to my team of providers, and they were like, yeah, like, we just feel like the risk of rejection is a little bit too high because it's not a perfect match. So that's kind of like the journey, and I'm sure we'll get more into the transplant later.
Yeah. Yeah. And I know that marked the period after your bone marrow transplant where you were grappling with your own fertility issues and you had encountered a very scarce, you know, community for resources, information, anything really, and then the resources to support such a costly procedure. And I know that that helped with the inception of this organization. But we'll get to that. We'll get to that. I don't want to get too ahead. But so for those who might not be familiar, you've touched base on this. First question that I have, um, how does sickle cell disease affect patients in ways that they might not be familiar with? You mentioned a few of them on your journey, what is, I think, the most, or not the most misinformed conception, but what do people not know about the symptoms of sickle cell?
Mhm. Well, I think that what people don't often think about is that anywhere there's blood flow, there could be issues, right? So that includes the brain. So strokes is a thing that can happen. Predisposition to things like clotting. Um, and so, a lot of what we do at SC Red is educating about the reproductive health implications. There's so much focus on, pain crisis and fatigue, which it should be. But there's also end organ damage because, like I said, there's constantly sickling, and people don't often consider that your like ovaries, that's an organ. And
Yeah.
so those things are affected. So outside of like the reproductive health, I think that a lot of people don't also consider the mental toll that
Yes.
having this illness can take on you. It's a chronic illness. And a lot of the individuals impacted come from marginalized communities. So there's also a lot of stigma that we deal with, like being drug seekers, being lazy. Our cells break down way faster than they should. So that causes anemia. So people think we're lazy, but no, like a lot of us are anemic. And so the mental toll of like fighting the stigma, having
Hmm.
to take on the responsibility of not just being sick and in pain in the ER, but having to educate the ER staff about what you're going through and having to fight and advocate for yourself, that really takes a toll. And
Yeah.
it's not even just the medical community, a lot of times your own family and friends don't understand simply because they don't have sickle cell and don't know what it's like. And so I think that the mental health is definitely something that people don't think about.
Right. And it's not readily visible to people, so they sometimes struggle to understand what they don't see. But
Exactly.
like you said, that's a big component, and you can never really separate the mind and body, and one affects the other and vice versa.
Exactly.
Teonna, your journey has been incredibly inspiring. How did you go about the process of taking something so painful and turning it into the advocacy work you're championing today?
That's a great question. I'm going to be honest with you. I don't really think I thought about it initially. I
Yeah.
just knew that something had to be done, right before I went into my consult for the bone marrow transplant, already doing research. So knowing that in order to go through this transplant, I would have to go through chemotherapy and at the time, full body radiation. So I knew that infertility was a possibility. And I remember going into my consult and saying, like, look, I'm willing to risk anything because there's a lot of risk involved with this process. I'm willing to risk anything, but I just don't want to be infertile. I've always wanted 6 children. And the response was, well, with all the complications you've already had, you're probably already infertile and just didn't know. So it was incredibly dismissed. And then it was like, just, focus on surviving. You can always adopt, but, the way you're going, you could die. So let's get you this cure. And I remember going home and doing this Google search, just kind of looking for education on fertility preservation. And when I stumbled across the cost, and being on Medicaid, I just knew that I couldn't afford it. So I started looking into financial resources, and what I saw was like a long list of foundations that would give away grants for fertility preservation, but you had to have a diagnosis of cancer.
Oh,
And I
wow.
even called some of these foundations like, hey, I know I don't have cancer, but I am getting chemo radiation. Like, can we make an exception? But long story short, I went through with it. Like maybe it is a fair trade-off if I'm going to be cured. I can give up this stream of biological children and I can adopt. And just as I evolved over time, realized that it should not have to be fertility or a cure. It should be fertility and a cure. And so I just had this vision, you know, all these years later that I would start a foundation, and I'd give away grants for sickle cell warriors wanting to preserve their fertility, because it's actually not just bone marrow transplants that can impact your fertility. It's simple disease progression, disease modifying therapies, other things. So I wanted to start a foundation similar to the ones that I had seen for cancer. And in talking with my now co-founder, Dr. Lydia Pecker, who was my doctor
Oh,
at
wow.
the time, and she was the first hematologist who ever sat me down and had a conversation about my fertility. And you know, she's like, yeah, but let's try to get some laws, like let's change
Yeah.
policy so we can really make a lasting difference. And then my other co-founder, Dr. Kim Smith Whitley, she was like, yeah, this is going to be great to do all this work in fertility, but she's like, it needs to go further. Like, we can't just address fertility without addressing delayed puberty or lack
Yeah.
of access to care for pregnant women. And so
Mhm.
that's how we went to expand the mission and become the first and only sickle cell organization in the world to have
That's
a
amazing.
mission around reproductive and maternal health. And I just really didn't even think about what it would mean for me personally. And I will say that it has been hard. It seems like a lot of what we accomplish is bittersweet.
Yeah.
Because even though we tackle everything, like we're all encompassing for reproductive and maternal health, I spend a lot of my days making sure that everyone else who wants it will have access to fertility services and healthy and safe pregnancies, two things that I won't have. And so that has been like emotional for me.
Yeah.
But
Very difficult, I can imagine.
yeah, but I feel like it's kind of like the next best thing
Yeah.
to helpfully provide resources that I did not have access to. So I really just kind of run off of passion and not wanting anyone else to experience what I had to.
That's really beautiful. That's really beautiful. You have a beautiful heart, Teonna,
Thank you.
and a lot of courage and strength.
Thank you.
The world is lucky to have you, making it a better place in this way. Which leads me to my next question. With your organization, what are some of the services and resources that the Sickle Cell Reproductive Health Directive provides?
Yeah, and so you can call it SC Red because I know that's an
Okay.
incredibly long name. We call it
Okay.
SC Red for short. So a couple of things that you know, the first year or so was really just about getting the conversation started because again, we were the first organization to really take this on, and so it's really about getting the conversation started. So we did fireside chats with men, women, the LGBTQ plus community, and also caregivers, just having different conversations and trying to remove the stigma from reproductive health. And then we also launched a preconception and pregnancy course.
Oh, wow.
And just last year, we began working on a reproductive life manual. So it's literally like a 40-page document on kind of like what to talk to your doctor about, what to talk to your partner about, when you should start considering. And it goes from puberty all the way up to menopause. And so we have that, and we'll be publishing that really soon.
That's exciting.
And then we've also we launched a partnership with Be the Match. Well, they now go by the National Marrow Donor Program. And you know, we met with them and said, like, hey, there's kind of a blind spot. It's great that you guys are sending all these people to transplant and matching them with donors, but what about fertility preservation? And so through
Yeah.
that partnership, there's now funding so that individuals going through transplants with sickle cell can apply to preserve their fertility up to $10,000.
Oh, that is so wonderful.
And it's only been up and running for like 2 years now. This is the second year, and we've already helped 22 people.
Wow.
So that's
Congratulations.
thank you. And then like this year we're doing our webinar series, so we're really big on education. Like the name, it's an education directive.
Yeah.
And we're also doing a lot of maternal health stuff this year. For women with sickle cell, the mortality rate is 26 times higher than the national
Wow.
average. And so we really
Wow.
want to do what we can to bring that down. And yeah, we're excited. We're going to be doing some women's retreats, some men's retreats,
Oh, that's so
bringing
wonderful.
people together. So we got a lot
Yeah, and really
going
help
on.
build that community, I guess, for individuals that probably feel very isolated in their journey.
Exactly. And we also plan to get into advocacy more. We have some legislative initiatives that we want to push forward.
Oh, I look forward to learning more about those as we remain in contact because that all sounds so wonderful. Um, Moving on to my next question, how can girls and women with sickle cell, those of which, as you just mentioned, are at an increased rate for reproductive health crises and maternal morbidity, mortality, ensure that they're receiving the proper care? What can they, or what do you recommend that they look for when searching for providers?
That's a really good question. I think that the most important thing to do is to just initiate the conversation first. So if you're being followed by a hematologist, bring this up. A lot of hematologists have come to us and said, like, hey, we only have a certain amount of time where we can see our patients, and we're usually focused on their pain, their energy level, things like that.
Mm-hmm.
And we don't always have the time or even think about prioritizing reproductive health into that conversation. So, what we really like to do is empower the community to prioritize it and bring it up. And so, just start by having the conversation. Um, for women who are, trying to get pregnant or are currently pregnant, it's really important that they have a comprehensive team. So your hematologist needs to be closely collaborating with your high risk OB. So really just advocating for yourself and making sure that you are getting comprehensive care.
Yes.
And also follow us.
Yeah, I was just about to say, I'm sure your website provides all of these wonderful resources and information that probably just in viewing videos or website material, they'll think of questions they probably didn't even have.
Right.
That's really great. This is a very big one. In recent news, the Biden-Harris administration announced that the sickle cell disease will be the first focus of the cell and gene therapy access model, which was initially announced in February of 2023. The model is designed to improve health outcomes, increase access to cell and gene therapies, and lower healthcare costs for some of the nation's most vulnerable populations. Um, Will your organization or does your organization provide more information on these kinds of therapies for patients?
We do. So it's really cool. We do this by a couple of ways. We have a partnership with NIH because my co-founder, Dr. Kim Smith-Whitley, and we were part of a working group to develop educational materials about gene therapies for sickle cell. We wanted to make sure that they were very patient facing, and they are housed on our website. And we're going to be launching a big awareness campaign around that this year. Also, I don't know, maybe some of the viewers saw the big 60 Minutes special that was on a couple of years ago with researchers from NIH and a couple of the patients who had gone through gene therapy. We are having a webinar, kind of like a follow-up to the 60 Minutes special that will be happening in March.
Oh, wow.
And we'll have several webinars. related to gene therapy so that people can understand the differences between the two that got approved.
Mhm.
Yeah, we're going to be doing the webinars. We have the educational materials on our website. And then we also have been in conversations with CMMI, because I don't know if you saw in the announcement that fertility services is included in that model.
I did not. That's so wonderful. Now, the webinar links, are they going to be on your website?
Yes,
Okay.
they are on our
Perfect.
website. They always occur on YouTube. I mean, they're always going to be housed on our YouTube channel. We live stream them, and you're right. I'm pretty sure they're on my website, but I
Okay.
need to make sure.
So everyone who might be looking and very interested can go on. I think it's sicklecellred.org is the website.
That's 100% correct. And if you sign up for our newsletter, our monthly newsletter, then you will definitely, that's another way to just stay in
Stay
touch
informed.
and
Oh,
stay
perfect.
informed and make sure that you get the, you can save the dates for the webinars.
Perfect. And then our last question, Teonna, what are your hopes for the organization? And what would you like to accomplish on behalf of the sickle cell community and reproductive health in the near and long-term future? I know it's a very, complex question, but
No, it's okay. I spent a lot of time thinking about this. So my number one goal for the organization is for it to be sustainable. Currently, I am volunteer and I am the only one working on the day to day. I have an incredible board, I have incredible co-founders, but as far as like day-to-day execution, it's really just me. And so my goal is, to bring in enough funding so that it is sustainable and that we can, have someone running operations, running programs, because what's happening is that our impact is growing way faster than our funding. So that's my goal, is to really increase funding and, get us a good infrastructure so that the organization can reach its full potential. And while we have that partnership with the National Marrow Donor Program, something else that I'm working towards is for SC Red to have its own fertility preservation grant program. Because like I said, it's not just going to be people undergoing bone marrow transplants who will need fertility preservation. And so we would like to have our own grant program where people would apply directly to us, and we'll be able to give them funding towards fertility preservation or adoption.
oh, wow, how wonderful. So exciting. And I really do hope that you can see all of those things brought to fruition in the very near future. I know big things are in store for your organization and definitely for the sickle cell community. You're doing really amazing work.
Thank you so much.
Yeah, no, Teonna, thank you so very much for taking the time to speak with me, to speak to our audience about this very, very important, medical condition, sickle cell disease, which affects so many people. And we want to be a resource. We want to have all this information accessible to those who may not know as much as they could, or who may be looking for other resources that they don't currently have. And I think this will be very, very informative for many individuals. So thank you again for taking the time to speak with me and to educate our audience so that they are more informed about their decision making and about their healthcare at the end of the day, so that they're empowered.
Yes, thank you so much for having me.
Thank you. Thank you very much. Okay, bye.